All right, gang, Dr. Andrew Krucke here. Just wanted to talk to you today about the differences between remote physiological monitoring and remote therapeutic monitoring. I actually just got off a call with a clinic that did not know the difference. And so let's talk about what they are. So, first of all, what's the definition of remote physiological monitoring? Well, it refers to the use of digital technologies to collect medical and other forms of health data, that's going to transmit that information back to the health provider. And the primary purpose of remote physiological monitoring is to allow healthcare providers to continue to track data for a patient once they're released to home or other care settings. So they're released to home. The types of data that is collected during a remote physiological monitoring would be things like vital signs, heart rate, blood pressure, body temperature, blood sugar levels, weight, respiratory rates, ECGs, electrocardiograms, right? Those are things that would be used by primary care physicians, surgeons, cardiologists. Remote therapeutic monitoring is a little different. That is really specifically for a physical therapist or a respiratory therapist. And that is focusing on remote collection and transmission of data related to the patient's response to the therapeutic intervention. So this is happening while they're with the provider, but it's supporting them when they're outside of the clinic, right? So physical therapy routines, you know, um, interventions, and so examples would be um, uh, patient-reported outcomes, so pain level, satisfaction, side effects or adverse reactions to treatments they received, progress in the routines for physical therapy, behavioral or cognitive responses to interventions, right? So those are the differences in data. Remote physiological data is more physician monitoring of vital signs, and remote therapeutic monitoring is more while the person's in physical therapy, we're tracking and monitoring the response to the treatments, their home treatments mainly. So, what are the differences in the devices or the technology that's used? So, remote physiological monitoring are devices that are wearable typically. So, think heart rate monitors, glucose meters or monitors, smart scales, pulse oximeters as an example. So, it's a wearable device. Remote therapeutic monitoring, it's not a wearable device. It's a software like a mobile app where patients can self-report or where they can see their home exercise programs. They can write journals of entries. So remote therapeutic monitoring is not a wearable device. It is an application that transmits information. So what are the benefits? Remote physiological monitoring has a lot of benefits, right? It's continuous monitoring of vital signs, early detection of potential health issues. It reduces the need for frequent in-person visits. That's the main goal. Now, remote therapeutic monitoring, the main benefits are personalized therapeutic interventions based on real-time data. So it allows us to modify their plan of care in the clinic based on their response outside of the clinic. And it's going to improve the patient's compliance to the home exercise program or the treatment plan and their engagement, right? That's super important here. We know that patients before remote therapeutic monitoring, on average, participate in the plan of care or the home exercise plan of care that the therapist creates only 35% of the time. So we're trying to increase that percentage, and really it gives us an enhanced understanding of the treatment effectiveness. Well, what are some of the challenges? So they both have challenges. Remote physiological monitoring, there's data security concerns, there's potential for data overload for the healthcare providers. You're getting too much information. And then, of course, the patients need to be trained on how to use the device. What are the challenges for remote therapeutic monitoring? Well, reliability of the data, right? Are the patients consistently engaging is probably the biggest challenge, right? And then determining the most effective treatment interventions based on the data that's being sent back to us, right? So I guess in conclusion, they're both great programs, different data, different ways of getting the data, and I would encourage you to learn more about both. Hope this video helps, to organize your thoughts.